The question of what is the better PD-1 agent right now. Of the two that are approved, pembrolizumab and Nivolumab, patients ask me, well, they're both approved, how are you going to pick which one you're going to give to me? And the answer is, well, we don't have any data to guide us on what is going to be better or worse because they've never been compared head to head. Now, when we do try to do cross-trial comparisons of looking at the response rate and survival, they seem extremely similar, so that I personally feel that these agents are almost interchangeable, to be very honest. Now, there's the anti-PD-1 agents, which I think don't have enough data yet to say, are they exactly the same as the anti-PD-1 agents? Now, that's a different molecule, of course, but go along the same pathway, and some of the same things that we're seeing with anti-PD-1, we're seeing with anti-PD-L1 with the durable remissions and low toxicities. However, I'm not quite sure that the response rates and overall survival are going to be quite the same as the anti-PD-1. So separating the PD-L1s from the PD-1s, that still, I think, probably needs more data to figure out the comparative efficacy of those. But the two PD-1 agents themselves seem almost identical. Now, the difference is, at least the way the label is written, is that pembrolizumab is given every 3 weeks and nivolumab is given every 2 weeks. And that's the way that the studies were designed. And they were designed by science and a way of finding out where's the sweet spot of upregulating or of hitting the target, and they just happen to pick different time points. Now, some people would say if you're given a drug every 3 weeks, well, that's probably, and it's just as effective, you might as well pick 3 over 2. And I'm sure, to be honest with you, that if we took Nivolumab, which is supposed to give every 2 weeks, if we gave it every 3 weeks, I bet the results would be the same. I doubt that study will ever be done. Maybe it will, but those are some of the thoughts that when we talk to patients about, well, one's given 2 weeks, one's 3, the toxicities seem almost identical, and kind of steer patients that way. From a managed care perspective, these drugs probably should be considered equivalent at this point until proven otherwise, I would think, because it's just so uncanny how close the response and survival of these agents are. Looking at pembrolizumab and nivolumab is almost akin to looking at, say, Advil or Motrin. They both are ibuprofen, they both are NSAIDs, they both take care of headaches. These drugs work remarkably similar as well. So from a managed care perspective, I would expect that they be covered in the same way that one would be versus the other. Now, the labels are slightly different, of course, with the dosing and how managed care is going to actually apply the 2 weeks versus 3 weeks. That's a decision above or outside of my area of expertise.